Well, ladies and gentlemen, a very warm welcome back to eCancer series on Ukraine, cancer and conflict. It's delighted to have with us today two very eminent oncologists to talk a little bit about their respective experiences in dealing with what has been an absolute catastrophe in terms of the impact of the Russian invasion on Ukraine. I'm Richard Sullivan from King's College London and also the chairman of the eCancer Trustees. And joining me today, firstly, is Professor Ruslan Baltaga, who's the director of the National Institute of Oncology in Moldova. Very warm welcome, Ruslan. Lovely to have you here. And also Dr. Horia Volpe. And Horia is actually joining us today from all the way in Honolulu. It's 10 p.m. in Honolulu. He's a radiation oncologist and also the director of quality and patient safety at Queen's Cancer Center in Honolulu, but also has been doing a huge amount of work with Ruslan, and he'll tell us a little bit more about that in a moment. He's originally from Eastern Europe, from Romania, I believe, Horia, and he's going to tell us about the work they've been doing in terms of managing a very complex situation. Very warm welcome for both of you. Let's dive straight in. First of all, tell us a little bit about your lives pre-24th of February, exactly what you were doing, a little bit about the work you've actually been engaging in. And maybe, Horia, I can start with you.
Sure thing. So first of all, thank you very much for having me. It's a great honor to be here. Like you said, I'm originally from Romania, and just in my upbringing, we had to face a very difficult healthcare system back home back in the 80s during the communist era. So that's kind of been pervasive for me in my medical education. I've always wanted to give back and contribute. And my global oncology work actually took me to sub-Saharan Africa, where I have several research projects ongoing. But probably more interesting and more pertinent to this is that between my work at Columbia University and joining the team here in Honolulu, I had a couple of months off and I had some friends in Kiev, Americans based there. So I went twice to Kiev and spent quite a bit of time there, and I got to know the city and the wonderful people of Ukraine. And I fell in love with it, as have, I know, many of my friends. And so when the war started, it was very much, very kind of hitting very close to home for me.
Thank you, Horia. And Ruslan, a little bit about your work. I mean, you've now obviously the director of the National Cancer Institute in Chisinau. Give us a sense of cancer care in Moldova pre-24th of February.
Yeah, I'm actually, let's say, not new director, but a recent appointment since January. Prior to that, I was associate professor at the chair of anesthesia from the State University of Medicine, and I was involved in COVID pandemic since the beginning. I'm president of Medical Foundation Valeriu Gheric as well. We have established a lot of activities. One of them was medical platform online teaching for doctors and nurses, and I'm anesthetist, and I'm since 2013 I'm doing locum jobs in UK. I've been working in various places. So prior to this position, I was doing 1 week in 3. Now I'm doing still 1 in 7 weeks. So I have experience working in UK as well. And my decision to apply for the competition for the Oncological Institute in trying to improve the situation. And for my competition, I've done a SWOT analysis, and the strong parts of this was the existence of such service in the country, the history of oncological service, existence of all aspects of cancer control, but weak parts are, of course, on background of let's say less affluent country, I would say poorest country in Europe, and obviously this will make a shadow on cancer service as well. We have a cancer national program for cancer control, which is a strong point as well, but we have achieved not much even before war. For example, screening program, mammar screening, we have the coverage of less than 5%. Colorectal, we are still trying to implement IFOP. In aspects of diagnosis, we still have long waiting times for CT. We actually don't have a functional CT in our institution. We contract outsourcing companies. We have problems at the level of treatment. We have in some areas like gynecology, mammology, we have waiting times more than 2 months for the surgical treatments. We have coverage of radiotherapy of less than 20% of those who need the radiotherapy, and in chemotherapy we have we can cover a treatment of about 50% of those who need treatment. So that was the background before the war.
So it's an incredibly challenging situation that you've come into, and obviously 24th of February changed everything now. I think it's right in saying there's probably been about 500,000 now Ukrainian refugees moving across the border into Moldova. Give me a sense now over the last 3 months of the kind of challenges you've faced in terms of managing either cancer patients coming across the border or new ones being diagnosed in Moldova.
So at the beginning of war, we were about to finish another crisis, fifth wave of COVID. You didn't have it because you had vaccination, but we had the fifth wave, which wasn't that bad. But taking into account the profile of patients, oncology, we still had a battle during this one. On 24th of February, suddenly we had a big number of refugees, and the first citizens, everyone was involved in helping those women and the children, especially. We were in contact with our colleagues from Odessa, for example, Professor Tarabrin, who sent his family. He's a colleague of ours. We were visiting his conferences. He was coming to us and other colleagues. So then I want to mention that probably one of the few moments when I really was proud of my people, you know, this big number of refugees, everyone was going to the border, was taking families, bringing them in their houses. 75 to 80% of refugees stay in our families. So and it was a big challenge, and it's still I mean, now it's less, but at the beginning you can imagine that was a terrible situation. With regards to cancer patients, initially we were involved in coordination of evacuation of pediatric hospital, a few hospitals from Nikolaev, but they didn't stay here. They moved to Poland. Then patients with cancer. So we had initially the indication from the Ministry of Health was to treat all the cases, but then they have reevaluated, and we were allowed to treat only emergencies. We had this option for patients who needed, but for the rest of them, we had the option to relocate in the EU, UK, Norway, and this process was quite, and it's still quite complex. For the rest of them, they refused to go to EU, even if they were offered this option for various reasons: language, culture, distance from home, and so on. And now we were looking for other opportunities, and the Ministry of Health was in contact with organizations, including Blue Heron, International Organization for Migration, and other organizations, and trying to bring on scene various other options for those who refuse to be relocated in EU.
So this is excellent, because I want to pick up, if I may, and go over to Horia about this, about the reallocation, and particularly to pick up on the Blue Heron Foundation's work. Because obviously this is a major challenge, and something that people don't appreciate is even if you offer care in other countries, patients might not want to go. Horia, tell me a little bit about the work the Blue Heron Foundation has been doing, and how you've been helping and working with Ruslan to solve this problem.
Sure. So I've been involved with the Blue Heron Foundation for quite a few years now. I know Stefania Magidson, who's the founder, personally. Now, the foundation initially focused on orphaned and abandoned youth in Romania and in Moldova. So they already had a wide network of contacts. And with the war, I sit on the board, so we had a few meetings, including with Dr. Ioan Keso from the Ministry of Health in Moldova. So that's when we learned about the problems with the refugees, with the cancer care, and that at that time, I think it was 190 of them had signed up to the Institute of Oncology with a cancer diagnosis. And the fact that cancer services were not, cancer treatments were not covered in Moldova. So we decided to draw on personal contacts in Romania. I have quite a few friends and colleagues in the cancer world in Romania that I know of. And then with the contacts and networks from the Blue Heron Foundation, we were actually pretty quickly able to put together a very large collaboration. We had a lot of help from a lot of people, including the Medicae IT team, which is a Romanian web platform for storing data, files from patients, and imaging. So that's kind of how this came up. And then I was introduced to Dr. Ruslan Baltaga, and we had a number of calls. I went to Chisinau. We had a 2-day conference and workshops, and we got to know each other, got to befriend each other as well. And then we held a tumor board for the first 5 patients that we identified were a little bit more urgent. And this tumor board was, attended by doctors in Moldova, Romania, the United States, Canada, even Ukrainian doctors practicing in the US. So then we prioritized those patients, and out of those 5 patients, 2 of them were willing to relocate to Romania. The first patient who got there just early last week is a 39-year-old woman, mother of 6 with cervical cancer. And she was prioritized, and she went to Cluj, Romania, and is getting treatment with radiotherapy for cure in the Amethyst clinics with Dr. Gabriel Cacho. And then the second patient just arrived this morning, actually, in the city of Iași in Romania to get a medication, anti-cancer drug, and he's going to be rotating back. Now, not everybody can or wants to relocate to another country. Some patients have family issues or maybe dependents. And for those patients who decide to stay in Moldova, we also are fundraising, and we have some funds, and we're looking to cover the cost of care and treatments in Moldova. So we're working with the Institute right now to set up the right contract so that we can, very soon start paying for some treatments for these patients who want to stay where they are.
It's a fantastic initiative. And I guess maybe I'd like to ask both of you, maybe in the closing remarks, to give us a sense of what do you think are your hopes and your concerns over the next few months? I mean, obviously the projections are that the conflict will continue potentially until the end of this year into next year. What are the kind of concerns and what are your hopes going forward? Horia, maybe I can start with you.
Right. So, we had some early success. We learned a lot from these first patients. And we are upscaling. We're hiring coordinators. We are hiring people on the ground to help us, translators and so forth. And we're strengthening these bonds and these relationships that we have with the Institute. So I hope that this collaboration is going to continue to grow because there is a need for it. We're going to continue to fundraise. We're blueheronfoundation.org is a website that people can go to if they want to help. Some of the challenges that we're seeing right now is that this is a situation very much in flux. The patients that were identified and signed up at the Institute, not all of them are reachable. Some have gone to other countries or returned to Ukraine or maybe changed their phone numbers. So the challenges for us are going to be to try to capture these patients, make sure that they're not lost in the system or unreachable. And then, like we said in the beginning, the cancer just progresses, right, every day. So we're running against the clock a little bit. And so myself, I'm going to relocate part-time to Eastern Europe starting in August to help with this effort and work more closely with Dr. Baltaga on this.
Fantastic, thank you. And Ruslan, I mean, key messages, concern from you?
Well, let's prioritize. One of our concern here that one day we can become immigrants and to be evacuated, because this situation in the region is very difficult. You know everyone, so Moldova is a potential target as well. So this is one of our concern. Then, if speaking with regards to cancer control and treatment, one of our concern is necessity for the fortification of our capacities, including diagnostic, CT, MRI, radiotherapy. We had a mission of experts from WHO, 6 experts, and we are waiting for their report. They had two objectives: one, immediate response to war crisis, and the second is long-term cancer control planning, including costification and so on. I'm an anesthetist, and I prefer things changing quickly, you know what I mean, but here it takes longer than I am used to as anesthetist, I mean. So that's one of our concern. Prices and the logistic. I'm telling everyone that since the beginning of war, we are paying for normal saline, but this is millions for us, four prices more, so four times higher prices. That's simple, but food, electricity, fuel, the inflation in Moldova is 30% since the beginning of war. So this is another concern that we might have. Another problem is, due to pandemic, we have a backlog since 2020.
Right.
Cancers coming, I mean, not exactly backlog, but patients who were, I mean, they had some problems. They didn't go to see a doctor, and now they come. We have cancers, let's say, which are eligible for screening, coming to us in stage 3 and 4, like mammary cancer, colorectal, which is quite a big problem and concern.
Yeah, I mean, it's, as you say, it's a real challenge across the board.
And another concern is constant influx of refugees, including from those who are already staying here, around estimation between 85,000 to 100,000 in country, but they still coming. So that's another. And even if war stops today, the crisis gonna be for a long time.
Yeah, and I think that's an important point to make to people, that the idea that the war stops and suddenly everything will go back to normal very quickly is not the case. Gentlemen, thank you very much indeed. We'll be talking to you again over the next couple of months. But on behalf of eCancer, thank you so much today for describing the challenges, but also describing some extraordinary work to try and bring solutions to all of this. Professor Ruslan Baltaga, Director of the National Institute of Oncology in Moldova, and Dr. Horia Volpe from the Blue Heron Foundation, and also Director of Patient Safety at Queen's University in Honolulu. Thank you both very much indeed.
Thank you. Thank you very much.
Thank you very much. Thank you.